Infections are a major complication and a significant reason for early deaths in patients with multiple myeloma. Immunotherapies like B-cell maturation antigen or BCMA-directed bispecific antibodies are effective but can increase the risk of infections through targeting of plasma cells and potential T-cell dysfunction. Thus, a comprehensive reporting system that can accurately determine the rate of infections is necessary to understand the prevalence of such complications and inform appropriate treatment and prophylaxis. Most clinical trials report event incidence, that is, the percentage of people who experience an infection. However, this metric does not factor in the possibility of multiple infections occurring per patient, nor does it account for the increase in incidence of events with longer follow-up, which could confound comparisons across trials of different durations. A research letter by Ludwig et al. Proposed using the infection rate per month per 100 patients as an alternative. However, the use of this metric could introduce bias, as it only considers the first infection event and divides it by the median follow-up. This includes follow-up for patients who have already had their first infection and are no longer considered at risk of an event by this metric, leading to a potentially artificial reduction in the infection rate due to patients who have experienced more than one event. In a recent editorial published in the American Journal of Hematology, researchers proposed using the incidence rate, which is incidence of an adverse event divided by the total person time at risk, as a more appropriate metric for assessing infection risk. According to the article, an incidence rate that includes all infection events experienced by individual patients would provide a more comprehensive measure and allow the timing of all infections experienced by patients to be better understood. Using the incidence rate to calculate at-risk time for patients reflects a simple change that can optimize infection reporting. The incidence rate could form the basis for a standardized approach in clinical trials, allowing for a better understanding of the relative risk of infection for a given treatment, more informed infection risk mitigation, and improved benefit-risk ratios for patients treated with certain therapies.